Hello everybody. Today we are going to discuss the therapeutics of tonsillitis. So we'll be covering the most important drugs. Now the first important drug is phytolacca. Phytolacca has the sensation of lump in the throat. Also you have eustachian tube affections. Also the throat, the common symptoms of tonsillitis will be persisting in all the drugs that will be there. But when you want to understand a drug properly, the spear and everything, you have to go to the LSMC. So location would be tonsils, throat, eustachian tube, and the sensations are mostly shooting kind of pain to the ears, burning pain in the throat. And the modalities is worse from the wet weathers or when it rains, and the changes of the weather, cold weather, night, motion, and better is dry weather. Now when you see the uvula here, it is dropsical, swollen. So you can't even swallow water here. So that is an important thing. So it's a classical tonsillitis, right? Whether it is follicular, whether it does pus, it is different. The symptoms, if it is matching tonsillitis of phytolacca, you can give phytolacca. Now coming to capsicum is slightly different from phytolacca. Here the burning of the fauces, the redness is prominent. Also you can find eustachian catarrh. It is a common symptom of tonsillitis, so it will be present mostly in all the drugs. Okay, but the great pain and the eustachian catarrh is present in capsicum. Now one important thing is burning in the throat in between the swallowing. Okay, between the swallowing is present in capsicum, not during the swallowing. Between two deglutations the burning is present, along with constriction, smarting, and aggravation would be open air and uncovering and draughts. So that is a common symptoms. Again, lot of common symptoms will be there, but the intensity differs. From phytolacca to capsicum, you can understand the intensity. The hot feeling is predominant in capsicum. Now coming to bell, the lump sensation, constricted sensation, it is present in phytolacca as well as lachesis. Now belladonna symptoms are mostly violent symptoms, so it comes under acute presentation of tonsillitis, right? Again everything is present: difficult deglutition, words, liquids, sensation of lump, constricted sensation, spasms, because the Solanaceae family and all, you can find the dryness and the spasms will be present. Now what are the aggravations? Aggravations are touch, noise, deglutition, and change of weather. Okay, now coming to calimure. Now calimure tonsillitis, firstly you should remember the follicular tonsillitis and hospital sore throat, right? Two important symptoms of calimure. Now calimure is secondary inflammation, right? So whitish discharges are present. If it is yellowish discharges, it is calisulf. Okay, calimure, you have suffocation, mostly tonsils that are suffocated, like causing suffocation, hardly breathing is possible in these kind of tonsils. So the excessively swollen, that is calimure, and you have eustachian catarrh similar to the other drugs mentioned above. Now also you have swallowing which is excessively painful. Even water or softest thing requires great strain. You have to twist your neck to get it down. So that kind of symptom is there. It is a very important symptom of calimure apart from follicular tonsillitis and hospital sore throat. Also the appearance of tonsils, it is grayish patches or spots on the throat and tonsils, right? Now the important symptom is already given: must twist the neck to get the softest food, whether it is bread or water, to get down. Okay, again deglutition painful is also present. That is a common symptom. Now coming to Beretta carb. Beretta carb is mostly tonsils in children, and you know the importance of mentals in Beretta carb, or when you're discussing Beretta whether to give or not, the mentals plays a very important role. Apart from that, important indication is quinsy and suppurating tonsils from every cold, okay, and tonsils that are inflamed with swollen veins that are swollen also. Okay, and then obviously you have pain, deglutition, but one thing is, can only swallow the liquids, cannot swallow the solids, right? Can only swallow the liquids. It is present in Beretta carb. It is the same symptom present in baptisia as well, because they have aggravation by swallowing solids. That is exactly opposite of lachesis. Okay, you have spasms, you have shooting, suffocation, and contraction sensation also present in the throat. Now one important modality of Beretta carb is worse thinking of the complaints, right? Also lying on the painful side. So you have spasms as well, right? Shooting and suffocation will also be there. Now again you have to remember the suppurative tonsils. And then coming to Merksol. Merksol is constant desire to swallow, and you have great increased salivation, and broad tongue. There is a characteristic to think of Merck salt. Also, night aggravations are also present. Now, one important thing you should remember is ulcers at every change of weather. Syphilis, right? Merck salt is syphilitic remedy. So, you have ulcers and inflammation appearing at every change of weather. That is Merck salt. Also, stitches to the ear on swallowing. Fluid takes wrong turns. That is also present in Merck salt. Now, coming to specific tonsillitis, quinsy, similar to Barretta car. Right? That is also syphilitic remedy, and this is also syphilitic remedy. You also have loss of voice, which is complete loss of voice, along with burning in the throat, as if hot vapor was ascending. Now, modalities are already discussed: night aggravation, damp aggravation, right sided affections. Right? Now, next we'll go to lac caninum and lachesis. Now, both the drugs, common points are there as well as the uncommon points are there. That is why we are discussing in the same place. Lac caninum and lachesis, mostly left sided remedies. Complaints go from left to right, right? And then you have tonsillitis and diphtheria affections. Now, both the drugs have diphtheria affections, tonsillitis, left sided affections, but the common point, right? Both the drugs are aggravation heat, right? So, the lac caninum is better by cold. Even lachesis also is better by cold applications, right? Now, coming to the differences in lac caninum and lachesis, the appearance of tonsillitis is what we're talking here. The appearance of tonsils, lac caninum is shiny glazed appearance, silvery appearance, pearly white appearance, like pure white porcelain. Also, you have stiffness, burnt, raw sensation. In lachesis, it is bluish black appearance and very painful. Can only swallow the solids, better by swallowing the solids and discharges. Aggravation by swallowing the liquids. You have spasms in the throat, which is that will cause when you're swallowing the liquids, especially hot drinks. Now, coming to bapticia. Bapticia, again, everything is a common tonsillitis symptoms are as well present. In bapticia, you have redness, tonsils, you have constriction, contraction of esophagus, everything is present. But one thing is great difficulty in swallowing solid food, which is exact opposite of lachesis, right? And in Barretta carb, you have aggravation, amelioration only, like aggravation solid foods and amelioration liquid foods, but great difficulty in solid food is not present in Barretta carb, which is only present in bapticia. You also have constrictions